Hello and welcome to SV Talks. So I want to introduce Rupert, who is the Veterinary International Technical Manager for ADM Protexin. I know you've been quite busy since you've landed. You've been go. So it's quite nice for you to take the time out and have a chat with us.
Yeah, thanks, Fisher. Yeah, that's great. Yeah, it's great to be here. First time in this region. We've had a fantastic few days talking about protection products, how we're going to use them, talking to vets in practice. So, yes, thank you very much for having me.
Fantastic. So, I wanted to start with, we'll start talking about the gastrointestinal range.
Yeah.
And what makes Protexin range stand out as a go-to solution supporting gut health in dogs and cats?
Yeah, interesting. So, this is very much how we sort of position ourselves in terms of we want to be that market leader, particularly in that gastrointestinal field. It's what our history has been. Protexin has been around for over 30 years. And we've always had that really strong focus on gut health in particular for dogs, cats, rabbits, horses, etc. So we pride ourselves that our products are both including high quality ingredients that are well researched, and also the products themselves often have a large amount of research or evidence behind them as well. So for us, this is the number one when we're thinking about introducing a product. We want to know that it is of the highest quality, and we want to know that it's actually going to be efficacious in our patients.
Of course. So when it comes to sort of common concerns such as diarrhea, such as bloating, for example, how would you say the Protexin gastrointestinal range can assist these animals in these instances?
So we have a range of different gastrointestinal products, and you'll use them for slightly different things. So we might have products that have ingredients that are well proven for things like acute diarrhea, for example, dietary indiscretion. So we might have particular products that are more useful for those. So the clinician might choose to add those in as part of their treatment plan. We also have other products that are more focused on longer term issues. So chronic disease like chronic enteropathy or IBD cases as well, or allergies. So treating vets and clinicians might choose to add in this product for this particular disease or this product for this one. But on the whole, they're really useful at adding in things like probiotics, which are going to be supporting that function of the gut by contributing to a reduction in dysbiosis, which is this change in the gut microbiome.
Oh yes, I love the term dysbiosis and symbiosis, isn't there?
We've got plenty more today. It's fine. We'll add in some new ones.
Yes. So that was my next question, actually. What is the need for so many products in the range? I think that, especially, I think it would be a good question that's asked by clinicians. Why should I have Procolin Advanced in clinic alongside Copalaplex, alongside Enterogenic?
So, yeah, they all do very different things. So we would have something like Symbiotic DC, which is a pro and prebiotic, which is sort of your daily driver. So you can use it for a range of different conditions. Clinicians might choose to use it for acute diarrhea, chronic diarrhea, alongside antibiotics to reduce that dysbiosis, your favourite. But then we can really start to tease into the different conditions and use ingredients that are slightly more appropriate for these as well. So, for example, our Procolin Advanced, we have a clinical study proving the efficacy against a control, placebo for acute diarrhea patients in first opinion practice. So we know that things like Procolin Advanced will be specifically tailored to that one condition, to acute diarrhea. Whereas things like Procolin Enterogenic will be more useful for things like chronic enteropathies. So we know because of the ingredients, we've got B12 in there. We know that about 60% of chronic enteropathies will need B12. We have ingredients to support the gut lining. We also have those probiotics, prebiotics, and postbiotics as well. So every product is going to be for something very slightly different in terms of gastrointestinal issues.
Okay. So can you shed some light on the latest research on symbiotics as a whole within the industry?
Yeah, absolutely. I mean, this is the really exciting thing about when we talk about the microbiome in general. So with humans, we've been getting quite a lot of new research into the last 10, 15 years about how we can, either measure things in the microbiome or then start adjusting things when we know that they're going wrong. And this information is just really starting to come through for dogs and cats and companion animals now. So there's the floodgates have been opened in terms of the interest in this sort of area. So we're looking at different types of probiotics. Which ones are more useful for different conditions? How can we use probiotics for things outside of, our normal gastrointestinal issues? Can we use them for other body functions? And we're also then thinking, you mentioned symbiotics. So how can we then incorporate different prebiotics, which are this food source for the bacteria that gets fermented? So how can we use different ones for different functions? So for example, we have one called Fibersol, which is very good for specific gut conditions, but we might use a slightly different one for another condition. So yeah, there's a lot more research to be had, but it's a really exciting time to be in the world of the microbiome.
Yes, it sounds very exciting. I mean, the possibilities are endless, and there's a lot of information out there, and hopefully more information as the science goes on.
Exactly, yeah. Big focus that's the number one thing that we're interested in, really. Let's get some more info, let's do some more research, and let's get people really excited and share that knowledge about the microbiome.
Incredible. So can you explain the key benefits? Now I'm going to kind of pinpoint some products here. So can you explain the key benefits of your Symbiotic DC, for example, compared with Cobaloplex?
Mm-hmm. Yeah, sure. So these are both capsules that have a powder you can sprinkle. So in that regard, they're quite similar, but in pretty much every other regard, they're quite different in that Cobaloplex is quite specific, really. So it has vitamin B12 in, and there's lots of evidence now for the need to supplement B12 in certain conditions. So this would be something that's really tailored to those patients that need B12 supplementation. It also has folic acid, so if we have a hypofolate-emia, so if a low folate, we might think about adding that in. But it also has a prebiotic in as well, and that's this food source for the bacteria that gets fermented to produce short-chain fatty acids, which is really beneficial for the gut. And we put this into our B12 product because we know that when patients have a low B12, they often have a concurrent dysbiosis as well. So we're trying to give that a helping hand at the same time. But Symbiotic DC, yes, that will have the same prebiotic, but it also has a probiotic as well, but doesn't have B12 or folic acid. So you might use that for example, if you want to reduce dysbiosis alongside antimicrobial use, you might use Symbiotic DC, but you would use Cobaloplex for if you had a low B12 situation.
Okay. That's one of the things I remember working in practice that I loved about Protexin products is the Pet Biotics label that actually tells you, oh, there's prebiotics in this, or there's pro, and post biotics in this other product. It was very, very handy.
Oh, I'm glad you found that useful. Yeah,
it's very useful.
We've recently introduced this sort of labeling, this Pet Biotics, because for years people were confused. So either vets looking at this on the shelf, I don't know what's in this product, or owners when you finally get this product home, your vet's given this out to you and you say, I have no idea what was in this, I can't remember. So it's just an easy reference guide. Now that there is more talk on the internet and from scientific people about these biotics, as we say, this is just a way of indicating exactly what's in the product. So it's really easy for people to understand.
Exactly. So how does Protexin Pro Fiber Advanced help with issues like loose stools or poor digestion?
So essentially, it's similar to some of our other products in that we have a probiotic in there. So we're still getting that effect on dysbiosis for things like some types of enteropathy, but also it's got lots and lots of different types of fiber, so both soluble and insoluble fiber. So when we're thinking about both gut motility and having that consistency in gut motility, but also thinking about the condition of the stool, like, have we got soft stools, have we got hard stools, then we know that fiber is really good at modulating the quality of the stool, modulating the consistency. So we can use it in things like when we have a constipation, there's good evidence for using fiber to modulate that and soften the stool. Whereas if we have very loose stools, then we know a lot of the absorptive capacity of that fiber will mean that we get a much better formed stool coming out.
Okay. And what kind of fiber is used within the ProFiber Advanced? Can you delve a little deeper?
It's a bit of a challenge on an afternoon. So I say one of the most important ones is psyllium.
Yep.
which is a fibre, but also acts as a prebiotic as well. So we're getting a bit of dual function with that. And that's doing a lot of the heavy lifting in terms of that absorptive capacity and that modulation. But we also have things like hemicellulose, insoluble fibre for bulking, and a few other different types of soluble fibres as well. Things like pectin, which would be useful. Actually, we might have to stop that because I can't remember if pectin's actually in it. So
Okay.
might have to edit that out.
I think it's in another one.
Okay.
So looking into procolin enterogenic, now I like to call that the mightiest of all the range. So in what situations would you be recommending procolin enterogenic?
So this obviously has a lot of ingredients. And at first you're thinking, oh, we've got this, we've got that. So the best way of thinking about it is really as a one-stop shop for if you have these long-term gastrointestinal issues. So treating clinician might choose to use it for a sort of waxing and waning or consistent chronic enteropathy.
Okay.
So when we know something's been going on for longer than 3 weeks, we might have, inflammation in the bowel, we might have softness in the stool, etc. These are going to be the classic ones to use procolin enterogenic for. So we have, as we said earlier, the probiotic, which is going to be helping with that dysbiosis in the gut that we often get with the chronic enteropathy. But then we also have 2 different types of postbiotic, both of which are going to be improving that overall gut function and also helping with that gut barrier function as well. So that lining to the gut, which acts as protective layer essentially. Then we also have vitamin B12, because as we've said, we know that about 60% of chronic enteropathies will have a concurrent low B12. And often patients won't improve until we treat that B12 as well. So we don't need to worry about adding in Cabaloplex. That's already in procolin enterogenic. And then we have 2 ingredients which are really good for building up that gut barrier function. So they're trying to increase the mucin level so that we get better protection from things like pathogens trying to cause more inflammation and continue this inflammation in that chronic enteropathy. So instead of having to give this product, then it's something that we can just give one thing that's going to have everything that's going to be beneficial in terms of a supplement to help support those chronic enteropathy cases.
Okay. And I know that the bentonite clay in there really helps to pull everything together.
Yeah, exactly. It can just be that little extra bit. It's not as much as something like procolin advanced, but it's just going to be a little something to help with that binding just at the end.
Yeah. So following on from procolin enterogenic, I wanted to ask about B12. So is there any chance of overdosing B12?
So this is one of the good things about B12 supplementation. So we rely with oral products, we rely on what's called a hypersupplementation, and we're relying on this passive diffusion mechanism within the distal small intestine. But the good thing is that as this B12 then passes through the body, excess is stored in the liver, and then anything beyond the excess that's stored in the liver is passed out via the kidneys. So it's passed out in the urine safely and isn't going to cause any harm to the body. There's been no evidence that we have any contraindication for using it, so we can use this hypersupplementation method quite safely. So we might potentially use this when, say, B12 testing is quite expensive or might not be possible. Then we know that supplementing with something like Cabaloplex is going to be safe in these cases. We don't need to worry about any excess. If in doubt, we can treat with these cases.
Okay, and that's in those chronic enteropathy cases where more often than not.
Yeah, absolutely. Yeah, so chronic enteropathy is going to be one of your number one cases where you can use B12. But also then exocrine pancreatic insufficiency, so EPI cases, that on average about 80% of these will have a low B12. And so recommendations, for example, from Texas A&M University, they often recommend treating lifelong with B12 for these EPI cases. There's also a few other ones as well, things like Emerson-Grasbeck syndrome, which is this hereditary condition where they don't have the receptors. We might think about B12 supplementation and a couple of other things as well. But your EPI and your chronic enteropathy are going to be your most common.
It's very interesting.
Cool.
So with the Protexin range, is there any age restriction when it comes to the provision for patients?
So it depends a little bit on the product, but realistically, so most of the safety testing for a lot of these ingredients, these products, we have the cutoff of 8 weeks. So as a rule of thumb, we would say that we wouldn't really recommend using the product for animals less than 8 weeks, apart from in particular circumstances. So for example, off-label, clinicians might choose to use some of the products in younger animals, but that would very much be up to the treating vet on a risk-benefit analysis. For example, if we sort of take a step back from the protecting products, then we know that some of the probiotics, things like Enterococcus faecium, which is in a lot of our products, have been used. Studies have been done in patients less than this age. But as a whole product, we would recommend 8 weeks is the cutoff. And then it depends a little bit on what we're using it for. So some conditions we wouldn't necessarily get until adulthood anyway, so there wouldn't be a particular need to use them. But some cases, might be something that affects juveniles more often, in which case, absolutely, we can add these into the mix with our treatment plans.
Okay, and that's for dogs, cats, rabbits?
Yeah, dogs, cats, rabbits, yeah,
Okay.
absolutely, yeah.
All right, fantastic. So the use of probiotics have been popular in both the human medical and veterinary industry. Do they have any limitations, or does their use have any limitations?
Oh, that's a really good question. Yeah, well, I could talk for hours. Yeah, struck myself in. So I think there's so much more that we don't know about their possible benefits. So at the moment, we can say, yes, maybe we'll use something like a probiotic for this or for that. So we are quite limited in terms of what we can actively advocate for at the moment, because we can only go off what evidence is out there, what papers have been published, what studies have been done. So a lot of those are focusing on gastrointestinal conditions at the moment. So we know that, yeah, maybe we could use probiotics for X, Y, Z gastrointestinally. I think where our limitation is that it's only a temporary one for now, in that we're starting to get more and more evidence for using probiotics for different body systems. Not just probiotics, but postbiotics and prebiotics too. So, for example, we have things like all these different axes within the body. So we have the gut-brain axis, we have the gut-skin axis, we have the gut-liver axis. So all of these different potential links.
Okay.
So we can start to think about maybe utilizing biotics, and not just probiotics, but other biotics for a lot of these body systems. Now, obviously, we have to wait for some of the evidence to be accrued and some of these studies to be done. But I think it's really positive now that there's a lot of interest and there's a lot of investment in this area. So I think in 10 years' time, we're going to see a completely different picture. And it's quite exciting because we're just finding out more and more every day about the potential uses of biotics.
Exactly. And it can further support patients who are currently being treated for certain conditions. This can also assist them. And I think the gut, I think it's been quite heavily underestimated.
Yeah,
and,
exactly.
Undervalued for quite a long time. And I think the information out there, as it grows, I think it's going to be very exciting what we find from that. Yeah.
And it's great. It protects him to be at the forefront of that, because even when I started, it was still sort of relatively niche in terms of the use of probiotics. Maybe, people were using it if they had gastrointestinal conditions or potentially alongside antibiotic use. But it was very minimal. And sort of people would give you a bit of a strange look when you mention the microbiome. But now, it's everywhere. I'm a bit disappointed. I was going to write a book on fermentation and probiotics, and then there's been about 3 released in the UK in the last few weeks. It's a huge area of interest at the moment now. So it's a really exciting time to be in that microbiome world.
Oh, fantastic. So, okay. So you mentioned the gut-brain axis, the gut-skin and the gut. And there's a lot of axes to
insert, but it's just in there.
Yeah.
So I'll talk a little bit more on the gut-brain, not just the gut-brain, but the gut-brain microbiome axis quite together.
Absolutely.
So I am aware that it plays a role in pet anxiety. So let's talk about that.
Yeah.
And what does it mean for the gastrointestinal health of these animals as well?
Yeah, that's a really good question. So we're almost finding we can do 2 things with one ingredient or one biotic, really. So as you said, quite rightly, there's been more and more research now on how are those signals sent from the gut to the brain. So we've known for a long time, signals come from the brain to the gut, and then that's where you get, all sorts of gut-related issues, stress diarrhea, etc., things like that. But we're starting to find now more that communication is bidirectional. So what we mean by that is that if we alter the microbiome, then we can start to get this feedback to the brain as well. So what this means in reality is we can start to think about microbiome support and changing the microbiome to help with different conditions that are affecting the brain. So things like anxiety, depression. There's been a new study that came out actually a few days ago looking at the gut-brain axis and Parkinson's treatment in humans. So we're getting a load of really good information about if we alter that microbiome or there are changes in that microbiome, what effects does that have on the brain? So we have, for example, in Serenacare, which is our calming support product. So we have postbiotics, and these postbiotics are specifically for mental wellness. So what we're trying to do is adjust that microbiome in a way that we will get positive effects on the brain and things like calming and anxiety. But at the same time, what are these doing? These are improving gut health, improving microbiome diversity. So at the same time as having brain benefits, then we might also get gastrointestinal benefits as well. So we're sort of doing two things with one ingredient.
Okay, that's fascinating, and I think it's great that Protexing is now stretching out, not just focusing on the gastrointestinal health, but also now gearing towards behavior of these limbs as well. Okay, so looking further into Serenacare, I know you love talking about ingredients of the products. So that's my next question.
Okay.
So looking into the ingredients of Serenacare, how can these specific ingredients help towards the calming effects for these animals?
So the idea behind Serenacare, our calming product, is to essentially be a multimodal product. So we're trying to do two things with one sachet, essentially. So what we're doing is we have the direct calming ingredients, so things that are going to be working to have, direct effect, essentially. So alpha-casozepine, which is a peptide that's going to essentially be having that direct calming effect on both dogs and cats. We know it's got really strong evidence for producing anxiolytic-like effects, but without having that sedation component. So we've got a combination of alpha-casozepine plus tryptophan. Now, tryptophan is very well known in the calming world. It's in quite a lot of products because, again, there's some good evidence in both dogs and cats for having that calming effect and reducing anxious behaviours within the home. So we've got that one aspect to the product, but also we have ingredients for the microbiome. Surprise, surprise. So we have a postbiotic blend. So we have two different postbiotics that we're using to try and reduce anxiety in our pets. And we also have Fibersol, which is a unique prebiotic, which is going to be fermented to produce short-chain fatty acids. Those are really beneficial for calming. I'll talk about that in a second. And also it's going to be improving or increasing the level of lactobacilli and bifidobacteria, so two health-positive species within the gut. And so the reason why we're trying to make these microbiome changes is if we think about the overall production of serotonin, so serotonin, the happy hormone, responsible for modulating a lot of calming behaviors, etc., mood, cognition, 90 to 95% of that serotonin is produced in the gut. So what we're thinking is there a way of ramping up that production? Is there a way of increasing your local serotonin production by altering the microbiome? And that's essentially what we're trying to do with these two microbiome-related ingredients. So we're trying to increase that local serotonin. Now, the serotonin doesn't then go on to cross the blood-brain barrier and affect the brain directly. What that's doing is then acting locally to send signals to the brain. If we think back to that gut-brain axis, we're then sending signals back to the brain by having that local serotonin production. So we've got the direct calming ingredients, the alpha-casozepine and the tryptophan, and we've got the indirect microbiome-related ingredients of that postbiotic mental wellness blend and that Fibersol. And then finally, just for palatability, we have an artificial chicken flavour as well. So all of our flavourings are artificial because we want to obviously eliminate the chance of meat protein allergies. So we just don't take that risk.
Okay. I've heard it's also it's very palatable.
Yeah, we haven't had any issues. Yeah, it seems to be pretty good. My cat, Brian, pretty old. He has no teeth, but he laps it up no problem. So yeah, he's a big fan. Yeah.
Okay. One thing I did like about Serenacare is that because it's in a sachet form, you can give it to a dog that's about up to 50 kilos, for example. So it's fully inclusive. Not just when it comes to your food allergy sufferers, but also when it comes to weight, because I know that you can have a number of limitations when it comes to our bigger dogs.
Well, exactly. We don't discriminate on size of pets here. We're very equal. So yeah, you just have one pack, and essentially that can be used for cats all the way up to bigger dogs as well. And we just adjust that dose of the sachet, as you said. So it's nice because it means you don't have to have, the vet doesn't have to have millions of products on the shelf. And for the owner, you've just got this one, you're not going to go wrong.
So looking into stressful events, because Serenacare, this is a time to use, to make use of Serenacare.
Absolutely, really coming up to it.
When you have a stressful event, the use of Serenacare, can you combine that with any of the other Protexin gastrointestinal range to really try to maximize the effects of the support?
Yeah, potentially. I mean, it really depends on your clinical scenario. So Serenacare is going to be your number one choice if you need some sort of support for calming, some sort of reduction of anxiety behaviors. So we've used that predominantly, but then you could be ready to add in, potentially other products if needs be. So, for example, something like a stress diarrhea, where, I would think as a clinician, I would be thinking, there's clearly a stress component here, so let's reduce the stress with something like Serenacare. And then potentially there's a gastrointestinal component as well. So we might just need a little bit more of those biotics. So we have the pre and the postbiotics in Serenacare, but we might want to add in some probiotics from something like Symbiotic DC as well. So we can have the potential to combine there. And obviously it's very safe to give with other things. So if you have a patient on long-term procolon enterogenic, of course you can then add in something like Serenacare if needs be when we're coming up to a stressful event. So there is the possibility to combine if necessary. I think it's also worth saying as well, if you already have a bit of a plan in place for calming your pet, so something like a pheromone plug-in, then absolutely we can use Serenacare in conjunction with that, because they work in different ways. So it's actually going to be a form of multimodal sort of therapy if we combine therapies like that. So definitely can be a good idea.
Yeah, so then you end up with more of sort of a holistic
sort
of wellness plan.
Exactly. We know that sort of on the whole, for most conditions, multimodal therapy is always going to be the most efficacious. And that means we can then get away with lower doses of everything as well if we're using lots of different combinations.
So now talking about the full gastrointestinal range and their different preparations or their different formats.
Yeah.
So how easy is it to actually incorporate these products into a pet's daily life? Because at the end of the day, they're going to be given on a daily basis or even, multiple times a day.
Yeah.
Especially with those fussy eaters.
Yeah.
Can you shed some light?
Obviously, every pet is individual.
Yeah.
But on the whole, our products tend to have really good palatability. As I've said about the flavorings, so we have a few different flavorings that are all artificial. So we're not worried about those meat protein allergies, but we can still get a taste that your pet is going to really enjoy at the same time. We have some great videos actually of procolon advanced. So you think, a paste for diarrhea isn't going to be very palatable. But we get cases where cats are literally just licking it off the end of the syringe because they think it's delicious. And that's why with our procolon advanced, we have a slightly different flavouring for your cats to your dogs because they like different things and they're a bit more individual. So on the whole, we get pretty good results. Most of them, we do quite like going down this route of having your sprinkle capsules. So for Cabaloplex, for Symbiotic DC, because again, it gives that option for, say, big dogs or cats. So cats, often you can just open, sprinkle on food, it's no problem. Whereas big dogs, if you're giving a few capsules, say, of Cabaloplex, then maybe it's easier to just give them whole and pop them down or wrap them in food. So we like to be a little bit flexible with the way you can give these quite often.
And so my final question is for the listeners and the viewers about myth debunking. So when it comes to the use of pre, pro and postbiotics, what are some common myths that you hear. What's your
Yeah, so
one about?
I'm not sure really, to be honest. I think we've got to really think about what we're trying to achieve with them, and then you can sort of walk backwards from there. So, for example, when we're thinking about using these biotics alongside things like antimicrobials, if we're trying to reduce that dysbiosis that we get when we use antibiotics, so metronidazole, we know it has a persistent dysbiosis for up to 3 weeks after. But then we need to think about, how are these drugs going to be interacting with the biotics? So we know that with probiotics, there's a potential there to reduce the probiotic that's in play. So we've always got to be thinking, let's make sure that we're spacing these out. We're giving these ample time so they're not going to be interacting with each other. But then we know that postbiotics are going to be dead or inactivated. So we think, okay, well, those are going to be fine to use with antibiotics. And then prebiotics, well, that's just the food source, so that would be okay. So it's just thinking about every different scenario and thinking about logically, does it make sense in terms of what are we trying to achieve with that probiotic? Are we trying to adjust gut function with this? Or are we trying to, have some other outcome as well? So just thinking back to every individual case, I think, really.
Okay. I find it interesting when we're looking into probiotics, for example, that as probiotics pass through the stomach, for example, a lot of them are killed, and essentially they turn into postbiotics, of which before we didn't really have a lot of information about their uses. So I think it's absolutely fantastic that now.
Oh wow, that's a
lot more information.
That's a whole different ballgame. That is, exactly. This is the confusing thing, that for years we've been really advocating that a postbiotic has to be alive when it reaches the gut to have efficacy. And now with all of this research about postbiotics, we're starting to realize that, that's not necessarily the case. On the whole, possibly still is, but for certain indications, as you said, that might be as efficacious if it's dead, or in some cases more efficacious. So it's really, the game has really changed in the last sort of 5 years. There's so much more information to take on board. Postbiotics, I think, is going to be a massive area of research, and it allows us to use many more strains that we otherwise couldn't use because of, regulatory reasons, etc. So we can start to use some really interesting types of strains and often get very, very good effect from those. In terms of going through the stomach, then we try to, so with our probiotics, do 2 things. So there's a bit of protection there in terms of against acid. So we know that most of them are going to pass through. And they're also given a high volume as well. So we know that those should pass through. But also then we can consider the use of other things as well, like postbiotics in this scenario.
So I wanted to talk about FMT, so fecal microbial transplant, which is growing in popularity in the veterinary industry for sure. What are your thoughts on FMT, and what do you think of the use, the procedure of FMT alongside the use of probiotics, or would you say there is a space for probiotics or postbiotics in these cases, or can they work alongside each other? What are your thoughts?
Yeah, I think this is a super interesting question, and it's something we've been thinking about a lot more. So as you said, FMT has really been growing. I remember when I was at university, we had this set as a specific sort of question we had to research overnight on our internal medicine week, and we all came to the conclusion that it was quite interesting, but didn't really have that many benefits. Now, obviously, as the years have gone on, we're now getting paper after paper demonstrating the benefit of this, different protocols to use for FMT, and it's really growing in popularity. And I think there's been some fantastic outcomes. So personally, I'm a huge fan of FMT. I think at the moment we're mainly focusing on using that for gastrointestinal issues. But potentially, who knows, there could be other reasons to use this as we go on. But in terms of how that links in and relates to sort of more commercial products containing probiotics, prebiotics, postbiotics, I personally think that all of these are doing the same thing. We're encouraging that understanding of the microbiome, what's going on with these dysbioses, and trying to figure out all the different ways that we can try and manage them as best as we can. Now, often they're really complex, so there's a lot of different steps for owners to go through and to take on board with their pets. So quite often I think that it works really well together in that we can have a case going through FMT, and then we can use some sort of, probiotic, symbiotic, etc., almost as your sort of continuation therapy until you have your next FMT, or, as a continuation until you have your next therapy, whatever it is. So I think, anything we can do to be supporting that microbiome is going to be beneficial. So, yeah, I actually am a big fan of potentially using both, or, potentially patient selection as well. If someone doesn't want to go through FMT, doesn't have the money, etc., but they need to do something, then maybe a symbiotic or a probiotic product is your next best thing. But I think in all of this, anything we can do to support that microbiome and sort of promote the knowledge of the microbiome, then I think that's beneficial for everyone. So yeah, big fan.
Absolutely. Well, thank you so much, Rupert. Thank you so much for your time spending with me talking.
Yeah, no worries.
Talking about the Protexin gastrointestinal range, and I wish you the best on your travels.
Thank you for having me, and yeah, had a wonderful time, and yeah, thanks for the pod.